So am I right to say that all these house screening packages actually is customizable to individuals?
Not really, actually, because the problem with health screening packages is that they are generally not really very customizable by the patient.
Okay.
Because the labs, the way they charge us, the clinics, which we pass on to the patients, is that the more you add tests, the cheaper it gets.
Okay.
So that's why if you notice, there'll be a huge jump in the number of tests from a cheaper test to a slightly more expensive test. Because generally lab pricing is such. There's not much that can be done about it. But in our particular clinic, I made it a point to specifically customize the packages for the kinds of patients that I usually see. So like most health screening packages, if you look at it, the ones that are provided by the lab are very generic. They tend to check for the things that, again, based on population data. But some of these tests are not really useful because they are not actionable. It doesn't mean that you can take action or do something to prevent.
Okay.
So there's no point in doing such tests. So the tests that are useful are things that have some meaning and they allow you to investigate further or at least be able to take some action to as a remedial measure to fix the problem.
Okay.
So in our clinic, all the packages that we have are customized by me. And when we first started the clinic and we designed the packages and we asked the lab to provide us with the costing, and based on that we offer it to patients. So generally the ones that we offer are quite comprehensive, but of course, there will definitely be other providers who also offer very nice health screening packages which are very meaningful. So it really depends on what the patient wants, how much they want to find out. Because some people have this natural tendency to get very anxious when they find out more about their health.
Yes, correct.
So, but the thing is that ignorance is not bliss. Because in the olden days they'll tell you, I'd rather not find out.
Yes.
I just die.
Yes.
So, but that logic doesn't apply anymore because nowadays the diseases don't just kill you.
Yeah.
They make you miserable for a long time. So in the past, you get something and then you just mati, straight away, like within a few months. But nowadays it's not like that.
I think nowadays technology also is very advanced.
It keeps you alive,
right?
exactly. Yeah. So what happens is you stay alive, but not in a healthy way, and not in a happy way. So you don't want that. The earlier you find out, the more effective your measures are in avoiding problems.
Okay.
So I think that's what I would advise.
I think the main thing is that with all the so many packages and all that, if let's say they don't know how to choose, I think they should seek
they should talk to a doctor.
Right?
So that would be best.
Okay, I think to end it off,
Sure.
Since our topics of the day is habits.
Yep.
So which habit do you think is the most harmful to our health and why?
I think the worst habit that anyone can have is like what I mentioned earlier, is to have a very strict routine.
Okay.
So I think that's the worst habit you can ever have.
Okay.
It's worse than smoking.
Really?
Yes.
Okay.
So a lot of people think that having a very fixed routine is very healthy. But I think routine is your ultimate enemy. Except for the fact that the only routine probably that's good for you is to have a regular exercise routine. But even that should be in moderation. So we don't want you to go totally crazy and berserk on exercise.
Really? But I've got friends that work out every day.
Exactly.
Is that okay?
No, you need recovery time. Yeah.
Okay.
The ideal number of times that you should exercise in a week, unless of course, let's say you're Chris Evans, that's a different story. He has to do it because otherwise he won't get his millions.
Okay.
So he's paid that much because he needs to keep himself in a particular shape and form. But for the rest of us, I think if you're looking at a general guideline, exercising 4 to 5 times a week is good. You need some breaks in between.
Okay.
Because if not, your muscles and the rest of your body don't have time to recover.
Okay.
In terms of diet, you really should not have a very fixed routine.
Okay.
What you should have is a range, a healthy range that you can choose from.
Okay.
So you probably should rotate around within that range. That keeps you in a healthy form and doesn't get you dependent on a particular thing for too long, and then you don't end up losing out on certain nutrition or having complications from taking too much of something. So I think that's the worst habit, in my opinion. I don't think you would have heard this, but because I feel strongly about this, and I always tell my patients, don't get stuck on something. Yeah.
I always thought like routine, all this is good.
Yeah, that's why I said. I mean, routine having of course, routine is good in the sense that it gets you used to doing something, so that you don't make mistakes and you don't get it wrong. Like for example, getting up in a particular time and doing your exercise and then having a breakfast. That sort of routine is fine. I'm talking about like dietary routine. So that our exercise routine, it should not be extreme. you shouldn't adhere to it too much.
Okay.
Yeah, that becomes a problem.
Okay.
Yeah.
Wow. Okay. That's a lot to learn today.
Yep.
So I think we have come to the end of our
Thank
show. Thank you so much for picking up.
You're welcome,
Jennifer,
Jennifer.
Rakesh. Yeah, that's the end.